I wanted to ask you, Doctor, about a story that crossed NPR today about multiple studies that say the death rate for COVID-19 has sharply dropped. And according to one study in the article, patients had 25.6% chance of dying at the start of the pandemic compared to a 7.6% chance now. So why is this, and what do you take away from this change?
Yeah, so when we look at mortality, I think it's important just to have context about this. So right now, like when I think about in Rhode Island, the mortality rate from COVID was around 10% the end of April, early May. That was the peak. We're seeing mortality rates under 2% right now. And what's changed? One is we're doing a lot more testing. So we're finding younger people. So when you find younger people, their cases, however, they do well, and they generally do well. The other thing is treatment has changed. We've made some progress in treatment in the hospital with dexamethasone, other steroid medicines, other anti-inflammatories. We're getting better at knowing when to use anticoagulation, in other words, thinning people's blood so the clotting doesn't become a problem. The ventilator management is better as well. So I think it's really just a couple things. One is we're finding more cases, more younger people, but also our treatment is getting improved. And so that's heading in the right direction there in that regard. That's why I think you're seeing that across the country as well as in Rhode Island.